This is Tasha's story. She's had trigeminal neuralgia for over 7 months. She hates eating on the right side of her face because it hurts so stinking much. This is her Christmas present. Watch her get better in this 3-part series. Check it out. Hi, this is Dr. Ace Thayer, your YouTube chiropractor, presenting the best results on YouTube. This is part 1 of a 3-part series. I have a couple questions for you today. If you're a chiropractor out there, why don't you take x-rays? She left the last one because he didn't. Also, do you actually believe that you can get your hearing back in 5 minutes with a single neck adjustment? I'd love to hear those comments and ideas in the comment section. Love you guys. Dr. Thayer here. I'm with Anastasia. And I love that name, even though I can't say it right. I'm going to get it right in the future. Tasha, right?
Yes.
Okay. She is from Bakersfield, and so she saw me just 2 little weeks ago and says, I gotta go see that fool. That guy's funny! And he looks like he knows what he's doing. Okay, so she came all this way, and she's staying here for a week plan.
Yeah.
And I really wanted her to say more, because when you actually hear all this stuff, it took me, I mean, I kept writing and writing and writing. There's a lot of stuff here. She's like, I just got this thing called trigeminal neuralgia. There's a lot more than that. So, Anastasia, why don't you tell them why you came here, and I'm gonna tell them everything else that kind of came with that.
Back in July, I just started having some arm pain. I woke up and I had this shooting pain in my arm, and it went all the way to my face. And then after that, I just started having sharp pains, like in my jaw. Whenever I would eat, if I would brush my teeth, my jaw would feel really tight. And I just didn't want to talk because I was like scared I was going to get like a shock in my face. And so then after that,
She gets these about 4 times a day, these episodes.
I was getting them about 4 times a day. I did go to another chiropractor. Do I say that?
It's fine. Don't mention his name.
Okay.
Or her name, but just don't mention it.
It was kind of helping, and then I stopped going, and then it came back. So then I've just been having them like ever since.
I went to another chiropractor too one time.
Yeah, he didn't take x-rays, so I just left.
Yeah, I love this.
Like,
so why, he didn't take x-rays, so why did you not stay?
Because he didn't know what was wrong with me.
Yeah, so I hope you guys learn from this. I'm critical about other chiropractors not taking x-rays, and she knew for herself, this guy is a schmo. If he's not taking x-rays, how can he know what's wrong with me?
Yeah.
Right? So it seems logical, guys. I don't know why you know these chiropractors who are not taking x-rays. Okay, so, and if you're chiropractors out there that don't take x-rays, I'd love to hear your response to that. That'd be kind of interesting. Why don't you? I mean, it seems pretty important to me. Okay, so July. So I had this problem. She's never had arm pain before, guys. She never had trigeminal neuralgia before. But she has a history of migraines, terrible migraines, 2 to 3 times a week all her life. Headaches every day, right? And her migraines aren't as bad as they used to be. And she says, they're just once a week now. And she's laughing about it because she's like, so much better than it used to be. But she has headaches all the time. So she has now, I'm thinking, ding, 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 ding. There's a lot more stuff going on, okay? Not that she's crazy. Okay, so why don't you tell some of the other things going on?
I get shooting pains in my arm, like shocks in my arm. Sometimes I'll get them like in my leg to my toes.
Gotcha.
My shoulder was just hurting so bad, so I went and got like they gave me a cortisone shot, but they told me it wasn't my shoulder, that it was my neck. And then after that is when I started feeling more of my neck pain, that it wasn't really my shoulders, it was more my neck.
And that's when she put 2 and 2 together. She goes, that guy's not just good looking down in Southern California. He also sounds like my problem. It's all coming from my neck. Okay, so again, we have trigeminal neuralgia, right shoulder pain. Sleep. Tell us about your crappy sleep.
I don't sleep well. I wake up maybe about 4 times a night.
Easy, 4 times.
Yeah.
And she says she's had this all her life, not all her life, for a long time, right?
I've had it for a long
Anxiety, depressions, that all goes along with lack of sleep too. And so we all know that, guys. I've educated tons of times. The interesting thing is this. I'm sorry, Mom, but she's full of poo-poo. So she goes 1 time a week.
Yes.
What? Is it okay if I said poo-poo?
Yes.
Okay, because I was going to say the other one, but I think since Mom's watching, I clean myself up. So she goes only one time a week.
Yeah.
And this is her lifelong thing, guys. She just doesn't go to the bathroom. So I told her I'm going to get that self squeeze going and she'll be happy as a clam. Okay, so heartburn daily all the time too.
All the time, heartburn, gastritis. I get at least like once a year where I can't eat and I can't drink and I'm just so bloated and just really uncomfortable.
Yeah. So she's got it going on, guys. She has motion sickness too. So motion sickness.
Yeah, I was like coming over here. I had a bag with me and it just wasn't.
Is that what you call your husband?
No.
Just kidding. I know it wasn't you. I mean, she had the mom and the kid here, but I just had to throw that in there because, yeah. Anything else that you want to share? Okay. So those are all the symptoms. Now she also has some stuff going on all her life. Before she had a. Let's talk about the bronchitis. How often do you get bronchitis?
I get it at least twice a year. It just depends. It just really depends.
And how often? How many years has it been going on?
Since I can remember.
Okay, so the reason I'm pointing this out, guys, because as she started to talk, I'm like, you know something? This goes back further. I started retracing all her stuff. I go, you mess up, girl. And so I go, what's going on? Let's go back further. I go, immune system problems, ear infections, colicky baby. Constipation goes back from when she's a little kid. She could have been suffered from, again, just birth. And you guys don't realize how far this goes back sometimes. And so she also has, not as bad as she used to be, because we talk about this in a second, but the sinuses. Tell us about your sinus infections.
There was a time when I was getting sinus infections like once a month, and I was constantly on antibiotics, constantly like in the hospital because I'd get like these horrible headaches. I had sinus surgery, and I would still get the sinus.
It's a little bit better, but the sinuses are not quite as bad, but they still get some.
Yeah.
Now, why did we have sinus surgery? This is the crazy part, and I want to hear your comments on this. She had sneezed so hard or coughed so hard.
I sneezed hard one night.
And she all of a sudden had water dripping from her nose. Not just water. Cerebral spinal fluid, guys, from her actual spine had penetrated her nose and it was leaking. She had a CSF leak. So tell us about that.
Yeah. Back in
2008.
2008, I was just sitting on doing my homework, and I sneezed really hard, like 10 times. And then after that, I just felt like I had a runny nose, but it was just like pouring out. I went to doctors for a whole year. They didn't know what it was. They thought it was sinuses. That's why they did the sinus surgery, because they thought it was
you didn't
sinuses.
tell me this. Oh, interesting.
And then
I thought it was an emergency thing. They didn't know.
No. That night that I sneezed really hard and got the leak, I had a horrible headache and my nose started bleeding, and I went to the hospital and they sent me home. And then I actually went online, looked it up, diagnosed myself. And I had my husband drive me to UCLA. We went to UCLA. I told him this is what I have, and they confirmed it in a few weeks. And then I had surgery about a month later, and I was in UCLA for a whole week.
So how much medical training do you have?
None.
What do you do for work?
I'm a stay-at-home mom.
Okay, so I'm only bringing this up, not to embarrass her at all, because she came in, the first thing out of her freaking mouth when she walks in here, she goes, I have trigeminal neuralgia, but I don't really have a formal diagnosis. I did it myself. Right?
Yeah.
And so I didn't know about the CSF thing. She's smarter than these fucking doctors out there, which is crazy. I'm sorry, Mom. I didn't mean to curse. But anyways, I'm laughing only because there's so many dumb doctors out there. I mean, the things that I hear out of these doctors, it's unbelievable. And you're like, I had diagnosed myself. I got my ass out down to UCLA Med Center, and it was exactly right. Bitches. I love that. I love that. You guys out there are probably smarter than the freaking doctors that you guys see. God damn, that pisses me off. Okay, so, except next to me. I'm smarter than all of you. Okay, so, okay, so I don't know what to say. That was too good. That was pretty funny. Okay, so tell us about your ears, and we'll finish this up.
I get a lot of ringing in my ears. Mostly at night is when I really like notice it, or I'll get like a humming sound.
But she also says he's fullness. They vibrate. Tell us about vibration.
They vibrate. Like kind of sounds like, I don't know, like something's in there, something like that. I've had that for a while, but since my neck has been hurting more, I noticed it more.
Gotcha.
lately.
That's enough stuff, guys. That's a lot of stuff. Anyways, she's here a week. I'm telling her to freaking get her ass back here because I already know that we're going to help her, but she needs a lot more help. Okay, so anyways, ready to get started?
Yeah.
Good. Stand over here, please. So we're going to go through different range of motion. I forget why you're here again. Oh, trigeminal neuralgia. Yes. So she doesn't have it right now, right? It's not happening this moment, but 4 times a day. So she'll have to tell us what she feels and how this is affecting her this week.
I mostly just have like numbness. Like I have like tingling like right here right now.
Gotcha.
Yeah.
Okay. So let's go ahead and bend over, touch your toes, please. Pain in your back there at all?
Actually, yeah, right here.
Scale of 1 to 10, what is that?
I would say a 6.
Oh, gee, I can't stand up. Go ahead and go back like this. How about that?
Maybe about a 4.
4, so a
Not
little
too
less
bad.
this time.
Yeah.
So when we did this before, by the way, why are you telling me it's a 6 now when you bend over and touch your toes?
Because I felt it more
You
right
felt this
here.
time?
Yeah.
Gotcha. Go ahead and look down the floor, please. No,
Look down.
Yeah, look down. Any pain in your neck there? You said it was a 5 or something. What is that now?
It's about a 5.
About a 5? Okay,
Yeah,
look at the ceiling, please. How about that?
I would say maybe a 2. Not too bad.
Not too bad. That was a pun, I think. Okay, look straight ahead.
What?
Spread your feet a little bit.
Okay.
Go ahead and squat, please. No, don't put your hands on your
Okay.
knees. No, hold on. Stop. Closer your feet. There you go. Now try it.
Okay.
Get a load of this, guys. No. Get your ass down.
Oh.
How much pain in your back and your knees?
My knees about like a 7.
Gotcha. And your
Yeah,
back?
and I'm like super shaky.
Mhm.
Can I get up?
Yeah. What about your back?
My back, I was about a 4.
Gotcha. So again, I wasn't trying to keep her down there. I just wanted to get down lower. So you didn't have to suffer. I appreciate the effort for suffering. That was nice of you. Okay, so let's do this. Go ahead and open your mouth nice and wide too. So this is all she can open her mouth, guys. And I remember seeing this when we did the X-rays. So that's difficult because why? Because the numbness in your face or because of the jaw?
It just feels really tight. Like
Gotcha.
I just feel.
Fair enough.
Really
Just want to get that
tight.
get that on camera. We're going to check a couple of things because I'm kind of curious. I didn't check this earlier. Let's check our hearing because I'm kind of curious about this. Is same or different?
This one is louder.
This is louder, so this left one's less. Okay,
Yeah.
let's do it again.
This one is louder.
How much less is this one? A lot? 50%? 10%?
Probably like a lot different.
Well, half, 50%, 75%? How much?
Probably 50.
50. Okay,
Yeah.
gotcha. Okay, so one more thing. Sit over here, please. Sit. So I'll try to do this on camera as best I can. So we're going to test her ability to feel, guys. And so we're not going to do the whole leg. The whole leg was numb. But we're going to do this. Okay, tell me the difference here.
This one.
More, right?
Yeah.
Gotcha. Do the toenail. Hold on.
This one more.
This one more. So this one's less, right?
Yeah.
How much less? I'm kind of curious. 50%, 10%, 30%? Because she has left sciatica.
I would say like 20.
20? Okay, go ahead and stand up,
Yeah.
please. That was a lot of work. Woo-wee. I need a break from that one. Are you ready? Are you ready to get adjusted? That was not
Yes,
funny. It's not
I'm
funny at all.
ready.
Okay, go ahead and lay down your back, please. Did you have the accident too? What accident did you have?
The what?
Oh, you fell in a Segway. Yes.
Oh yeah.
Yeah. Scoot down a little bit, please. Okay. She went on a Segway and bonked her head on the ground. I thought that was
Yeah.
interesting, but again, this all came before that. So, you've been adjusted a couple times. This is gonna be a little different. Are you excited? Nervous? What do you got?
Excited and on
Good.
both. Yeah, nervous. Too.
And also, we're gonna shout out to the husband. Thank you, because this is your what? Christmas present.
Yeah.
Yeah, thanks for sending down. That was sweet. Good. She goes, "Don't give me anything. Just send me to Dr. Thayer." I've been girls' Christmas presents before, but not this way.
Oh my gosh. Oh my gosh.
Come on, that was funny. It wasn't funny.
No. Yes, a little.
Okay. Okay. So, most important thing you can dance. What you do is relax. Okay. Good. We'll take our time. Okay. So just relax. Check it out. How
I feel like I'm getting a cramp
Where?
in my right
Shoulder blade?
Yeah,
Yeah. Right or left?
right.
Right one. Okay. How was that? Was that painful adjustment at all?
No,
No? Wasn't too bad?
no.
Gotcha. Okay. One more this way. Okay. So, what is the reality of that adjustment versus what you saw on TV? How is that different, or is it the same?
Well, on TV it looks like more painful.
Painful? Was it that painful?
No, it wasn't painful at all.
Good. So, was that similar to your other adjustments by the other chiropractor?
No, sometimes the other chiropractors couldn't pop my neck.
They couldn't?
No, or they would do it like very lightly. They didn't do it like it would never pop like that much.
I have more jokes here. I'm not gonna stop. I gotta move on. I gotta go to work. I'm like, oh my God, she's setting me up right now. Okay, so we can get you up in a second, okay? No twisting or turning. Keep your eyes looking straight ahead, your arms at your side, just relax. The more you twist and turn, the more you're going to undo my work.
Okay.
Sit up. Throw your legs over the side, sit right here, please. Good. Okay, so we're going to move in a second, but no twisting or turning. Do you feel any difference, any first impressions? Or if you don't, it's okay. But if, I'm just curious if you have anything on top of your head.
I feel a little
Dizzy?
Yeah.
Okay, anything else?
My neck feels really way lighter than it did.
Lighter. That's a good term. Okay.
Yeah.
Anything else? Or you just want to get moving now?
My shoulder feels like a lot of relief right now.
Cool. And so more than when you were injected with those chemicals?
Yeah.
Okay, so we're going to walk down the hall. When you
Okay.
walk, just again, arms at your side, look straight ahead. Don't twist or turn.
Okay.
Just relax and cruise.
Okay.
Don't go fast. Okay, go ahead.
All right, what time?
Your favorite drink works fine. Put it in the home bar.
It's going to be difficult to write the thumbnail for this one.
Okay.
Everything's better.
That you know will be good because
Miracle hearing comes back. No more headaches.
you, your family,
My shoulder feels better.
holiday gifting just
I would have CSF fluid. Go ahead one more time.
All right,
Please.
so you want
Breathe in
Friday?
through your nose. Breathe out through your mouth.
All right, bye-bye.
Nice and relaxed. In through the nose, out through the mouth. Good. I can feel again.
get free shipping too.
My poops are so much better. My stomach doesn't hurt. No, my acid reflux. I mean, there's a million things. How do you focus on this stuff? Okay, let's go back in the room, please. Good. How dizzy are you, sir? Ma'am.
I'm not
bad?
dizzy no more. Yeah.
I'm gonna have you stand to the right. Right there. Okay, so any other first impressions before we check you?
My left side of my neck is starting to feel kind of like sore.
Okay.
I don't know. But my right side feels like really, really like light.
Okay, cool. So I just want honesty, so I'm glad you tell me exactly what you're feeling. So let's go ahead and bend over, touch toes. Go ahead and bend over. That was a 6 out of 10 a minute ago. Yeah, and?
No, just my legs.
So that was a 6. Is that better now?
Yeah. Yeah. I didn't feel any pain.
Did I
So
rub your ass?
yeah, no.
Did I smack you?
No.
Nothing I didn't touch
No.
you? Nothing off camera?
No.
Jeanette, you agree?
Mom's watching.
Oh, that's right. Oh, that's right. Anyways, go ahead and go back. That was a 4.
Maybe like a 2.
2? A little bit less though?
Yeah, yeah.
Gotcha. Go ahead and look down, please. That was a 5.
I would say a 1.
Okay. Okay. Cool.
But it's like on the.
I got you. Just, even if you told me I was full of shit, just say something. Just tell us what you actually think. Okay. Go ahead and look at the ceiling, please. That was a 2.
No, nothing.
Gotcha. So those are all there.
Yeah.
Okay. So this is a fun one. A couple fun ones coming up. Spread your feet a tiny bit.
Okay.
Squat your ass down. How's that 7 or 8 out of 10 pain in your knees?
Oh, it's like maybe a 4.
And your back?
My back was like a 3. It hurt. Yeah, it was sore.
Gotcha. What was it? A 6 before?
Oh, maybe like a.
No, it's fine. No.
Okay.
I just want the truth.
Okay.
So let's do it again.
Okay.
Squat. Get your ass down. Yeah. Look at her posture, guys. So much better. So much stronger. How's the knees again?
Oh, my knee's about a 3.
Gotcha. In the back.
I don't feel as shaky.
Yeah.
My back, I would say maybe like a 2.
Gotcha.
Yeah.
So again, all we're trying to do is show you change.
Mhm.
You know, I always tell people, I want to create value for you. You come all this way. You want to see some miracle, and I love giving out the miracles. It's just what I do. It's just like you just give them out like candy, like blah, 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 just give them out. And so I want you to be like, oh my God, it's a miracle. And it's just so unbelievable that I feel this good so quickly. And so I just like giving them out like candy. So anyways, feel different?
Yeah.
Good. Okay, so next one. Let's go. Let's check her hearing. Okay. That was 50% less before. So we go. This is a face that she doesn't want to, can't believe that her hearing's coming back.
I can't. It's
The same?
no.
I mean,
It's not.
I keep waiting. I keep waiting for like. I want to call I say it's full of shit, but I want to say full of shit. That's what you get. She kind of wants to do that, right? She's like, I want to say it, but I can't.
I feel like I hear the same. Like the same, like, you know, better the same.
It's fine.
Give her medical degree.
I know. Get a medical degree. Okay, sit down. Okay. Now, you know, I have this foot fetish, so I'm going to finish with this. Okay. She's like, you're like, hold on. Mom, did you hear the laugh? I don't know if that. Okay, anyway. Ready? Same or different? Okay, you can say full of shit. Just say it's the same and you're full of shit. Just say both.
No, it's better. I feel like I feel the same thing
Yeah.
on each one.
Yeah.
Yeah.
How many times have we tested that before this? We've tested like 3 or 4 times, right? And it was always different.
Yeah.
Cool?
Yeah.
Yeah. Can you believe it?
I can. I can believe it. I was expecting this.
Yeah, well, my reputation precedes me. I get it. Thank you for coming down. Wonderful first day. We have a lot of fun with her, but again, I'm so happy to help her, and I'm happy she's here. I'm happy she's on my videos because she could have been stuck in Bakersfield and feeling like shit for a long time. So she's here, getting her better, and you guys get to watch and see it on camera live. No jive. See you guys.